Hi, I'm Melissa Cady, and I'm an independent anesthesiologist and the owner of Painless Wellness. And this video is just to kind of give you a little bit of information of what to expect for a twilight anesthesia for your procedure that will be done at the clinic. It'll either be myself or a nurse anesthetist covering me if I'm not available at that time. However, the plan is to have you, if you're going to be taking some preoperative medications, that those are taken 45 minutes to an hour ahead of time. The most important thing is that you don't eat for 8 hours prior to the procedure scheduled time, and also you can have fluids during that time, but the last 2 hours right before the procedure, it's important to stop consuming the fluids. Of course, if you're having fluids during that initial 8 hours, we'll make sure it's not anything with a fatty, like creams or anything like that. But again, 8 hours of no eating, drink fluids, and up to 2 hours before you'll stop taking any fluids in. Now, of course, this procedure with the twilight anesthesia is something that we want to do in a safe manner. So the most important thing is, first of all, we'll check your vital signs, your blood pressure, heart rate, and everything. Go ahead and start a small IV. It's the size we put like in children, a very small IV either in the hand, forearm, or at the elbow level, and that will be placed. And then the medications that are used is typically a relaxing medication called midazolam or fentanyl for a little pain medication. Those two together, of course, we titrate that according to the needs that you have and the effects that you get from them. We want to make sure that you're breathing well on your own. We're trying to do this procedure without any oxygen, as far as additional oxygen. You'll just be breathing room air, because if we're working on a face, then we want to be out of the way of the person doing the facial procedure. So we do have emergency equipment and have that at arm's length. If we need that, we can administer oxygen if we need to. But we want to take you to a place where it's mild to moderate sedation. And it's important that the patient has the right expectation, because we don't want to go in the realm of general anesthesia, meaning that we have to do additional monitoring, and it's usually a supplementation of oxygen, and it kind of defeats the purpose of us trying to get this procedure done in an efficient manner and be out of the way of the person doing that procedure. Now, just because you have mild to moderate sedation doesn't mean you're going to remember everything. Many times people don't remember anything, or sometimes like bits and pieces of it. So hard to know depending on the patient, such as if a patient typically consumes quite a bit of alcohol or medications called benzodiazepines, then there is a little bit increased risk that you might remember. But regardless, the point is to make this more comfortable than you would be if you're wide awake. And also the relaxing medicine, it just takes you to another level where you don't care as much, and this just makes it go by a lot faster. So very important that you understand what to expect, especially in a remote setting, and also when we're working on the face area. So we want to keep this just a few medications just to take the edge off and make this go by smoothly. So if you need or have any concerns or questions about any of your medical issues, and we need to have a further conversation beyond what was received by the anesthesia provider, myself, or my nurse anesthetist, then we'll be happy to do a Zoom call to discuss those issues. Otherwise, we can keep the communication open with simple little questions or comments on text messaging. We look forward to taking care of you for your in-clinic sedation or your twilight anesthesia for your in-clinic procedure.